Physicians have learned in training, one of the things we learn to do is work around the system. So by putting our patient welfare first, when the system isn't working, we've been taught and rewarded for actually coming up with a workaround or some way to get what our patient needs, but we are completely oblivious to the impact that workaround has on the system. It may actually make the system worse. One of the things we can do to take responsibility is avoid the workarounds and identify a place where we need to do a workaround and turn that into an opportunity to fix the system or to change the system.
I'm known in a lot of quarters as someone who adopted electronic health records early on, and a lot of people think of that as a technological issue. But for me, the joy of that, and I really would use the word joy, is when I'm seeing a patient and I say, when we're discussing prescribing an antibiotic for an illness with a fever and the person's feeling terrible, would you like me to fax that to the drugstore for you? And the look on the patient's face, oh my goodness, that would be so wonderful. I was expecting I was going to have to go and hand the prescription and wait for it to be filled, and I'm feeling terrible. Using technology, using systems to meet predictable needs gives me a sense of being able to do my job that is deeply satisfying.
I think it's been under-recognized that physicians have larger obligations outside, sort of in the context of medical practice. A small example would be how in our clinic can we do a better job of enhancing quality, patient satisfaction. We should be looking at patterns of care for patients that we have with common disorders, diabetes, hypertension. How are we doing in providing evidence-based care to those patients? We want to look at is the whole experience for patients optimal? So a patient may come into the office and see me, and I may have a very wonderful interaction with them, provide them with the care they need, just exactly what they need, nothing more, nothing less. But if they have to wait in a long line to check in at the clinic and they have to wander around the hospital aimlessly trying to find the lab, I have some accountability for that, to understand that that's happening and be partnered with others in the institution to fix that. Even beyond the healthcare context per se, I think I also have obligations. I think physicians have obligations to think about access, to think about other determinants of health.
The patients interact with a lot of people in the office besides me, and trying to create an environment where every person in the office, the people answering the telephone, the people taking blood pressures, the people faxing documents, everyone feels the importance that for each patient, this is a really critical activity. It's important to get it right. It's important to do it well. It's important to do it courteously, to infuse the whole practice with a service ethic. And I had a conversation just yesterday with a business manager in our office who said, you know, I really like the way that these outreach calls we've been making to patients, we're really helping people. It makes me proud to go to work. So structuring an environment where people feel that they're working as part of a medical enterprise, that everybody feels like they're working as part of a medical enterprise, has been very important for me.
If you talk to doctors, they will tell you they value most the time they spend with their patients. And they feel that that time has been eroded and intruded upon in ways that don't contribute to good patient care. And I think what we need to do right now is give them hope that as the system changes, and it inevitably is going to change, that the interests of our profession and our ability to manifest the professionalism can be coincident with the needs of our country. That's what I think we need in health system reform. Hope that it will be better for patients, and hope that it will be better for them in a way that is very internalized, so that they get joy in the work that they came to do.